All right, folks. Well, here we are again with Dr. Priya Sampathkumar, who is a returning guest on the Healthcare Unfiltered. We keep Priya busy because she is a trusted source of information with all things infectious disease. And God knows we've had our share of infectious disease issues over the past couple of years. But it seems like ID, Priya, is the gift that keeps on giving. We're going to talk about monkeypox today because it's all what people are talking about. It seems like we're okay with COVID for a while. But well, let's start by a quick introduction as to who you are, where you work, and then we're going to start do everything, all things monkeypox today.
Okay. So I'm Priya Sampathkumar. I'm an infectious disease physician at the Mayo Clinic in Rochester, and I am also the hospital epidemiologist for Mayo Clinic.
And Priya, you've come on this show several times. You've been truly amazing because one of the things I always keep having you, and I know how difficult it is to schedule these with your schedule. Believe me, I totally appreciate that. But I love the fact that you stick to facts. I love the fact that we try to ignore the noise. And, with everything that happened with COVID and politics and everything, it's difficult not to get emotional sometimes and bring politics in the mix, but you've stayed above that and you've actually stuck to the facts. And that's really why I'm very excited to bring you in and talk about monkeypox. So let's start by a simple question. What in the world is monkeypox?
So, monkeypox is a viral infection that's very similar to smallpox. The virus is in the same family as the smallpox virus, and the infection seems to be primarily an animal infection that sometimes spreads to humans. So, the disease was first described in 1970 in the Democratic Republic of Congo, but it's thought that perhaps cases had been occurring before that, but it wasn't until smallpox was really eradicated that people began to realize that there's this other entity called monkeypox. The infection tends to be milder than smallpox. But in terms of appearance of the rash, it's very similar. So it's a febrile illness, fever, generalized symptoms, and then a rash. The rash is generally starts out on the face, on the hands and feet, and then can become widespread. People are generally not as sick as with smallpox, but there can be deaths associated with monkeypox. It's the mortality, depending on the strain of the virus, can range from anywhere from 1 to 10%. So it is spread from person to person much, much less efficiently than smallpox. One of the reasons that smallpox was so feared was because it was very infectious. Monkeypox, on the other hand, is not very infectious and mostly comes from animals to humans, and then there's limited human to human transmission, usually just within close family contacts or sometimes in the healthcare setting to healthcare workers.
So the virus is not the smallpox.
It's not the smallpox virus, it's the same family, the orthopox viruses.
Okay, and it's been going on. I mean, it was discovered in 1970. I hope my listeners will tune to this after they realize this is the first time I knew that monkeypox existed. Have I been completely ignorant about this virus, or am I not alone?
So it was something that didn't very often cause outbreaks outside of Central and West Africa. So a lot of people outside of infectious disease specialists have probably not really heard much about it. In 2002, 2003, there was actually a fairly large outbreak in the US, more than 70 or so suspected and confirmed cases in all. And this happened primarily in the Midwest. And it happened because some animals that were imported from Ghana came with the infection. As I said, although it's called monkeypox, it's primarily rodents that get the infection. And so there were these large rats. It's unclear to me why they were being imported into the US, but these rats were housed in the same facility as prairie dogs, which were being sold as pets. So these prairie dogs, which are also rodents, got the infection infection, and then pet owners acquired the infection from these pets, either through close contact with the animals, with their bodily secretions, or sometimes from scratches or bites from these animals. And there was very limited transmission again to other humans without the pet contact. And it took a while for these animals to be removed from the household and for transmission to end. And there were lots of changes to sort of pet importation after that, and then that outbreak just died out.
I was going to ask you because you did mention animals when it first started, and the name is monkeypox. I was literally going to ask you, do they get transmitted outside of monkeys, and if so, why do they call it monkeypox?
So the reason it was called monkeypox is when this virus was first discovered in 1958. It was actually an illness in some research monkeys that had been imported into Denmark. That's where the virus was first discovered and found to be different from the smallpox virus, and so it was called monkeypox. But perhaps calling it rodent pox would be more accurate.
Yeah, because it seems like it comes through like other like rodents. So we did have an outbreak 20 years ago, what you're saying, and it died out pretty fast. What happened now? Like, is there anything that we can explain as to why we have a, well, first of all, do we have an outbreak? Is it just a couple of cases and the media is going crazy? Like what is happening right now? How do you classify the current situation of monkeypox that we're dealing with?
So, over the course of the last several years, there have been sporadic cases of monkeypox outside of Africa. So, there's been an ongoing outbreak in Nigeria and in several other African countries. And typically, these outbreaks have been sort of in areas where there's a lot of that are primarily rural, where there is exposure to these animals, and then some limited human to human transmission, as I said. But there have been, hundreds to thousands of cases in Africa. And then periodically, maybe once or twice a year, there will be an imported case in the West. The US had 2 cases last year in travelers coming back from Nigeria. The UK has had cases. Singapore, Israel have all reported cases. But there's been really no widespread transmission outside of these endemic countries. And what has happened this time is a very unusual phenomenon. It's been, again, imported cases coming from there. The first case that was reported in the UK in May of this year was an imported case. But then surrounding that time period, there have been other cases reported in people who've had no travel history. They have not traveled outside of the UK or Western Europe, and there have been multiple countries in Europe that have now reported cases, and then Canada, the US have also reported cases. So definitely, the case count keeps changing from day to day. Just in the US, it's there have been 12 confirmed cases as of this recording in the end of May. The total case count in the Western world is more than 300 cases. So definitely something has changed from 1 to 2 cases per year outside of Africa. Over the course of the last few weeks, we've had over 300 cases. So definitely something has changed.
Can you speculate why this has changed? I mean, is there any ongoing theory among infectious disease specialists as to what may have happened?
So we know that cases have been rising in Africa, but very slowly. And the theory behind that is that the smallpox vaccination the smallpox vaccination programs ended kind of in the late to mid 70s. The smallpox vaccination was protective against monkeypox. As we have sort of the population level immunity to smallpox is decreasing, cases in Africa have been increasing as a result of that. And generally across the world, more and more people are now susceptible to monkeypox. So that's one explanation for why, in the past, imported cases didn't, propagate, but now these imported cases are propagating. The second theory is that all of these current clusters of cases have been in this aftermath of COVID. We've all been, not traveling, avoiding crowds, etc. There's a lot more travel. Some of these cases have been associated with mass gatherings, so close contact in crowded quarters of people may have contributed to increased cases. And then there's, speculation, and it's still just speculation about, has the virus really changed? Has it somehow become more transmissible? And therefore, we're now seeing more cases.
So, I think so. I was born in Syria. I believe I got vaccination on smallpox. I presume I did. I honestly don't know. I think I have, and I think you probably have as well. Am I at risk if I've been vaccinated against smallpox?
So, those who have been vaccinated definitely are at lower risk. Again, our vaccination was many, many years ago, so it's possible that our immunity has waned. But the current cases, if you look at the 300 or so cases that have been reported, have all primarily been in young people who never got vaccinated. So, it's possible that, the people, and there haven't been direct epidemiologic links between all the people who've been infected. So it's possible that there's sort of been subclinical cases or cases in people who have been vaccinated who didn't have any manifestations, who had a subclinical infection that's allowing the chains of transmission to continue. So definitely vaccination seems to be protective. So if there were maybe clinical cases only in young people who've never had vaccine, but the other people with some partial immunity are allowing the infection to be transmitted.
So right now, is vaccination mostly mandatory for smallpox in the US?
There is no vaccination against smallpox. So the entire world stopped giving smallpox vaccine. All smallpox vaccine stores were actually destroyed, I think in the 80s.
But
Now,
I've had before that, right? We've
right,
had it before that.
right.
So right now, you can't get vaccinated against smallpox right now.
There's no commercial vaccine available against smallpox. Now, there are two different vaccines that are available, but just, it's in the national stockpiles for the US. Most countries have some vaccine capability because smallpox has always been considered a biologic threat. So they have maintained some stockpiles of the smallpox vaccine. Now, there's no mass smallpox vaccination happening anywhere in the world because the smallpox vaccine itself does have some side effects. And so when the threat of smallpox is non-existent, there was no point in getting the vaccine and having the side effects from the vaccine. So no one is being vaccinated currently, but when there are cases, there is a role for sort of vaccination of people who've been exposed because vaccination can prevent infection if given soon after exposure.
So, but the idea was that we've eradicated smallpox, and that's
Exactly.
why we did not need the vaccination.
Mm-hmm.
And all of the cases that we've seen so far are monkeypox. We have not seen smallpox.
No, absolutely.
Okay. But there is a theory that the vaccine against smallpox could work against monkeypox. So I don't know. Theoretically, we have 300 cases. If next week we've got 1,000, we need to start thinking, right? What are
So
we?
I'm not sure what the threshold would be. There's not enough vaccine anywhere in the world for a mass vaccination where every U.S. citizen could be vaccinated against smallpox. I think that the approach will still be what we call ring vaccination, vaccinating people around the cases of monkeypox rather than mass vaccination. Now, we didn't really get into this yet, but there is a fairly long incubation period from the time you're exposed to the time you start having symptoms. It can be as long as 3 weeks. On average, it's about a week to 2 weeks. So that intervening period, when you know that you've been exposed, is when there's room for getting the vaccine at that point.
Got it. Priya, I saw a few reports that suggested, and I don't know how accurate this is, that this could be a sexually transmitted virus. There were some, I think there was a report I read on BBC or something that also it was more common amongst homosexual men, or I couldn't verify any of this. Have you seen any of these reports? Have you heard about them? Are these, do you believe that this could be a sexually transmitted thing?
So we know that the infection is transmitted through close contact. And what has been different about this outbreak, so I said the rash typically appears on the face and then spreads to the rest of the body. So in this outbreak, a lot of people have been presenting with rashes in the genital area. So that's what started this thinking about, could this be a sex? Is the mode of transmission through sex? And I think the answer is it's not exactly a sexually transmitted disease, but because the people who have presented have had sexual contact with other people with these lesions, and you have generally have fairly close contact when you're having sexual intercourse. I think that's the reason why it's presenting with a rash in the genital area. I'm not sure that it's a traditional sexually transmitted disease. The other thing that you brought up about a lot of the cases, the majority of the cases have been in men who have sex with men. Again, one reason for this is that the disease was introduced into this population, and there have been several mass gatherings in Europe of these groups, one in Spain and one, I think, in the UK. And so these settings promoted transmission, but it's not a sexually transmitted disease or a disease that primarily affects certain subgroups. I think it just happened to be introduced and the circumstances were right for ongoing transmission.
Okay. So we've talked about the incubation, which is longer. You've talked to us a little bit about the symptoms, which generally sound they are mild. I guess I'd like maybe to talk about prevention and then about treatment. I mean, is there anything, I mean, we don't want to really make people panic. It's 300 cases worldwide, right? This is in the US, we're talking 10, 20.
So 12 confirmed cases, so not very many.
Yeah, 12 confirmed. I mean, is there a possibility that we have more? They're just not confirmed. I mean, that's possible.
It's possible. Again, this is not something that anyone in the practicing in the US has likely seen because smallpox was eradicated a number of years ago. Monkeypox is vanishingly rare. So most of us have not actually seen cases. So it could be that there will be a delay in recognition. But again, the CDC has sounded the alarm. People have been asked to be on the lookout for febrile rash illness. So I think with our heightened awareness, hopefully we will pick up cases.
So in the infectious disease lingo, I mean, I know we talked when we were dealing with COVID, we talked about pandemic, endemic, whatever it is. I mean, is this similar to the Ebola days where we just are on the heightened alert and we may get a few hundred cases. I mean, where do you, on the spectrum of how you classify infectious diseases, where are we with monkeypox?
So I think that this does not is not something that is likely to turn into a pandemic, and I'm knocking on wood because we just can't afford another pandemic.
Please,
But
please, no.
But I think that just based on infectivity, it's unlikely that we'll see this kind of unchecked spread like happened with COVID. The second thing is, as far as we know, although we're hypothesizing that some cases may be subclinical, the vast majority of patients have symptoms, and they do seek medical care because the symptoms are highly visible with a rash and fever, feeling unwell. So unlike COVID, where there's a lot of asymptomatic individuals who are kind of fueling transmission, it's unlikely that that will happen with monkeypox. So that's the two reasons why I don't think this really has pandemic potential. The some of the other reasons are that we do have vaccines already against the disease. So the existing smallpox vaccines do work against monkeypox, and we can scale up production if we needed. So that's the other reason why I don't think this will spread unchecked like COVID did.
It's not necessarily a pandemic, it could be like an endemic or something else. But okay, so that's good news. That's great news. The for when we were dealing with COVID, there were a lot of advice to general public, masking, vaccinations, social, all of that stuff. Currently, there is nothing that people need to do in terms of behavior to minimize that risk. There is no reason to panic. There's no reason to sound the alarm. It's an illness. If you feel uncomfortable, seek medical attention, seek medical help. There's nothing that I need to do to minimize my chances of getting it or anybody else needs to do, right?
If you're in an area where you're still masking for COVID, that will also help protect you against monkeypox. And then, unlike COVID, it isn't highly infectious, so you will need prolonged contact for it to spread. Now, we talked about the close person-to-person, skin-to-skin contact. It can also spread through respiratory droplets, so that's why the masking can help prevent infection.
Got it. About pets, because we did mention rodents and you mentioned dogs and so on. Pet owners, anything they need to do at this point?
So we don't know of any pets that have become infected. So the 2002 outbreak, it was clearly these prairie dogs that had become infected in a pet facility. There's no animal to human transmission ongoing in the US right now. So pet owners do not have to be worried because this virus can spread to animals. If you have an infection, you may want to avoid contact with your pets. But other than that, you don't really run a huge risk of getting monkeypox from animals.
So let's talk treatment. I'm assuming it's supportive care, but I don't know. I mean, if somebody gets infected with this, is there any actual therapy or you just run its course and it gets better on its own?
So supportive care is very important. The rash, if it's very extensive, there is a risk of secondary bacterial infection. So people need to be monitored carefully and may need to get antibiotics. If the illness is very severe, so some groups of individuals are more likely to get severe disease. That would be children, very young children, and then those who are immunosuppressed. And so if they have a very extensive rash or they have very significant systemic symptoms, there are some antivirals that theoretically can work against monkeypox. There's two different antivirals that have been tried in past imported cases of monkeypox. And both of these, again, are not commercially available. They're in the national stockpile. So a case has to be confirmed, and then the CDC has to release the medication. But there are two different antivirals that are available.
Okay, and this you would basically, not everybody needs these antivirals. At the physician's discretion, I guess, based on the severity of the illness. But you could essentially get better without any treatment.
Right.
Right. You scared me a little bit with the mortality rate. I admit, 1 to 10%. I did not expect it to be that high. Are there any characteristics where you would expect somebody is at higher risk of mortality? What do people die from? If they die, I presume this is the population that you want to treat if they have a higher risk of mortality.
So there are two different strains of the virus. One's called the Central African or the Congo strain, and that's the strain that has the higher mortality. All of these cases that are occurring currently actually are of the West African strain, and that has a lower mortality, around 1%. Now, in the last outbreak in Nigeria, the mortality was reported to be slightly higher, up to 3% in HIV infected individuals. And remember, these illnesses, as I said, are happening in very rural areas, sometimes very remote areas. So when you don't have good supportive care, mortality can also be higher. The imported cases that have occurred, there have been no deaths in the Western world. So you need to keep that in mind. So which groups of people can have higher mortality? We already talked about the HIV infected individuals, but any kind of immunosuppression can be associated with more severe disease. And then very young children. And that is partly because of the fact that, older people do have some residual immunity from their prior smallpox vaccination, but anyone born after 1980 has not been vaccinated.
People die from what? Like arrhythmias, sepsis? Like what's the...
Usually from sepsis, because the skin rash can be very, very extensive, and you can have secondary bacterial infection. People can also get pneumonia and die from pneumonia.
Yeah, yeah. Okay, what else do I need to ask you about monkeypox? I mean, what else do we need to cover? I read a thread that you put in on Twitter, I think a few days ago. I liked it. It was very, very nice, and it really prompted me to chat with you today. But what else should we tell listeners about monkeypox, if I missed anything?
I think just watch the news, find out if there have been cases in your area. I think that to the general public, the risk is very, very low. If you're a healthcare worker, you do need to be on the alert for unusual presentations, fever, and a rash illness. You need to just think about monkeypox. If you don't test, you won't find out that it's monkeypox. So make sure that you're asking patients for a history of travel, history of contact with other people with a rash. Those are two things to be on the lookout for.
I mean, the rashes, the pictures I've seen on the internet the rash is pretty impressive.
So that's the thing. So the typical course of monkeypox is first you get a fever, headache, a fatigue, malaise, prodromal symptoms, and then the rash. So by the time the rash occurs, you should be thinking you're not well. However, with this current outbreak, many people have been presenting without that prodrome, with no fever, and the rash. So the monkeypox rash, the typical rash that happens with the cases, is fairly widespread. The lesions are big, they're deep seated, they're very obvious. It's hard to mistake it for something else. But with this current outbreak, people have been presenting with just 3 or 4 lesions, mild rash, which is why perhaps transmission has been happening, because the cases are not feeling very sick. They're not feeling ill. They don't realize they have an infection.
Well, I feel a little bit better after talking to you. I'm not gonna lie. I think you see a lot of these things on the news, but I think you put things to perspective. It does not seem to be any reason to panic or sound the alarm. Just be on the alert, and probably healthcare workers need to be on the alert mostly. So My last question to you, Priya, is that you have been back in the day when we first dealt with COVID a little bit critical of the CDC, appropriately so, by the way. I was very critical as well. How do you think the CDC is handling? What grade do we give them handling the monkeypox so far?
I'm not going to go into a grade, but their communication has been surrounding monkeypox has been good. They've quickly updated the website with information for clinicians, information for the general public, and they've been quick to point out, there's been a lot about this being sexually transmitted, perhaps only certain groups of individuals are at risk. They've been quick to debunk that because I think that's again a feature of how which population the disease was introduced into. It's not really a disease of any types of subgroups.
Tried to get you in trouble with the CDC. Tried. Can't blame me. But I think it's wonderful to have this clarification. Priya, this has been extremely helpful. I really, really appreciate taking time. We're taping this for the record on Memorial Day weekend, and Priya is on service, on rounds, and still took time off schedule to be with us on Healthcare Unfiltered. I very much appreciate this, Priya.
You're welcome. Thank you, Chetty.